Have you ever noticed your legs feeling heavy, cold, or strangely tingly without knowing why? Poor circulation can quietly impact your daily life more than you think. Today, we're here to reveal 12 important signs that your blood flow might need a little extra help, and more importantly, how you can support better circulation naturally. Stay with us, because even small changes can make a big difference in how you move and feel every day. If you've ever felt these strange sensations, you might already be facing the early whispers of poor circulation without realizing it. But what exactly is poor circulation? Before we explore the 12 warning signs, it's important to first understand what this term really means and why it can quietly affect your health in ways you might not expect. Poor circulation isn't a disease itself, it's a warning signal that something deeper might be happening inside your body. At its core, poor circulation means that your blood isn't flowing as freely and efficiently as it should. And when blood struggles to move, it means that oxygen, nutrients, and even your immune defenses aren't reaching the places that need them most, like your muscles, skin, and organs. But here's where it gets even more important. Poor circulation can happen in different parts of your circulatory system. Sometimes it's a problem in your arteries, the blood vessels that carry oxygen-rich blood from your heart out to your body. Other times, it's in your veins, the vessels that bring blood back to your heart, and it can even involve your lymphatic system, which helps move extra fluids and fight infections. Understanding which part is affected matters, because the symptoms and the treatments can be very different. That's why recognizing the early warning signs is so powerful. Catching circulation problems early can help you avoid bigger issues down the road. Stay with us because next, we'll uncover the hidden causes behind poor circulation that many people don't even realize are happening. Now that we have a clearer idea of what poor circulation really is, let's dig a little deeper. You might be wondering, why does blood flow start to slow down or struggle in the first place? Well, the truth is, poor circulation usually doesn't happen overnight. It's often the result of slow hidden changes inside your body that build up quietly over time. Have you ever noticed your legs feeling heavy, cold, or strangely tingly without knowing why? Poor circulation can quietly impact your daily life more than you think. Today, we're here to reveal 12 important signs that your blood flow might need a little extra help, and more importantly, how you can support better circulation naturally. Stay with us, because even small changes can make a big difference in how you move and feel every day. If you've ever felt these strange sensations, you might already be facing the early whispers of poor circulation without realizing it. But what exactly is poor circulation? Before we explore the 12 warning signs, it's important to first understand what this term really means and why it can quietly affect your health in ways you might not expect. Poor circulation isn't a disease itself, it's a warning signal that something deeper might be happening inside your body. At its core, poor circulation means that your blood isn't flowing as freely and efficiently as it should. And when blood struggles to move, it means that oxygen, nutrients, and even your immune defenses aren't reaching the places that need them most, like your muscles, skin, and organs. But here's where it gets even more important. Poor circulation can happen in different parts of your circulatory system. Sometimes it's a problem in your arteries, the blood vessels that carry oxygen-rich blood from your heart out to your body. Other times, it's in your veins, the vessels that bring blood back to your heart. And it can even involve your lymphatic system, which helps move extra fluids and fight infections. Understanding which part is affected matters, because the symptoms and the treatments can be very different. That's why recognizing the early warning signs is so powerful. Catching circulation problems early can help you avoid bigger issues down the road. Stay with us, because next we'll uncover the hidden causes behind poor circulation that many people don't even realize are happening. Now that we have a clearer idea of what poor circulation really is, let's dig a little deeper. You might be wondering, why does blood flow start to slow down or struggle in the first place? Well, the truth is, poor circulation usually doesn't happen overnight. It's often the result of slow hidden changes inside your body that build up quietly over time. Another important sign your body may be showing you is a noticeable change in temperature in your hands, feet, or limbs. Have you ever touched your foot and felt that it's unusually cold compared to the rest of your body? Cold extremities can mean that arterial blood isn't reaching certain areas properly. This lack of warm, oxygen-rich blood makes your skin feel cooler to the touch. In some cases, you might even notice one foot is significantly colder than the other. On the flip side, if a limb feels warmer and swollen, it could point to inflammation or an infection brewing beneath the surface, often linked to poor lymphatic drainage or venous insufficiency. Temperature differences might seem subtle at first, but they are another quiet way your body tells you that circulation needs help. Recurring infections are another red flag that poor circulation may be affecting your body's ability to heal and defend itself. Our bloodstream plays a crucial role in carrying immune cells where they're needed most. When blood flow slows down or becomes blocked, your body's ability to fight off bacteria and heal wounds drops significantly. If you find yourself dealing with frequent skin infections, cellulitis, or slow-to-heal sores, especially on your legs or feet, circulation could be to blame. Conditions like erysipelas, which cause redness, swelling, fever, and sometimes painful blisters, often develop more easily when lymphatic drainage or blood flow is impaired. It's not just about external infections either. Poor circulation can weaken your entire immune response, leaving you more vulnerable overall. Hair loss and changes in nail growth might seem like cosmetic issues at first, but they can be early warning signs of serious circulation problems. Blood carries oxygen and nutrients not only to your muscles and organs, but also to your hair follicles and nail beds. When circulation is compromised, the body prioritizes blood flow to vital organs first, often reducing blood supply to the skin, scalp, and extremities. You might notice thinning hair on your legs, especially below the knees, or even patchy bald spots. Toenails and fingernails might start growing more slowly, become brittle, or change in texture. If one leg or foot shows these changes more than the other, it's a particularly strong sign that local blood flow is not what it should be. These subtle changes are often overlooked, but paying attention to them can catch circulation issues early, before they cause bigger problems. Muscle atrophy, the gradual shrinking and weakening of your muscles, is another silent but serious indicator of poor circulation. Muscles need a steady supply of oxygen and nutrients to stay strong and active. When blood flow is reduced for an extended period, muscles can't maintain their strength. Over time, you might notice your calves, thighs, or even arms appearing thinner or feeling weaker without any major changes in your activity level. Walking might feel more tiring, stairs might become more challenging, or you may lose endurance during simple tasks. Sadly, muscle loss can create a vicious cycle. Weaker muscles mean less activity, and less activity worsens circulation even further. Recognizing early signs of muscle atrophy and seeking support can help you preserve your strength, independence, and overall vitality for years to come. Tingling, numbness, and that odd pins and needles feeling are more than just annoyances. They can be early warning signs of poor circulation. Have you ever noticed your feet or hands falling asleep, even when you haven't been sitting awkwardly? Or maybe you feel a constant slight tingling in your toes or fingers that doesn't go away easily. These sensations often happen because blood isn't reaching the nerves the way it should. Without enough oxygen and nutrients, nerve endings start to misfire, causing numbness, tingling, or even burning feelings. In more severe cases, these symptoms can spread up the arms or legs, signaling that circulation problems are affecting larger areas. It's easy to dismiss tingling as just a random occurrence, but when it happens often, or is concentrated in one limb, it's time to listen carefully. Addressing circulation early can prevent nerve damage and maintain healthy sensation in your extremities. Another alarming but little-known sign of poor circulation is something called amaurosis fugax, temporary vision loss in one eye. Imagine you're going about your day, and suddenly you can't see out of one eye, only to have your vision return minutes later. It's terrifying, even if it's brief. This happens when a small blockage, like a cholesterol crystal or blood clot, temporarily cuts off blood flow to the retina. While vision may come back quickly, this episode is a serious warning that larger circulation issues are at play, often involving the carotid arteries, which supply blood to the brain. Ignoring these episodes can lead to bigger, more dangerous events like strokes. If you or someone you know experiences sudden painless vision loss, even for a few minutes, it's critical to seek medical help immediately. Finally, let's talk about blue finger syndrome. It might sound unusual, but it's a clear sign that blood flow to the extremities is severely compromised. When small arteries become blocked, sometimes by tiny cholesterol pieces or blood clots, oxygen can't reach the tissues, causing fingers or toes to turn a bluish color. The skin may feel cold, tender, or even painful. Sometimes only one finger or toe is affected, while in other cases, multiple areas can show discoloration. This condition is more than just a cosmetic concern. It signals a real risk of tissue death if circulation isn't restored. Blue finger syndrome is a red flag that circulation has become critically poor, and urgent medical attention is needed to prevent lasting damage. Watching for changes in color and sensation, even in just one finger or toe, can save much bigger problems later on. As we journey through life, our bodies naturally go through many changes, and unfortunately, our circulatory system is no exception. Aging affects blood flow in ways that can make seniors especially vulnerable to poor circulation and its complications. Understanding why this happens can help you take proactive steps to protect your health. First, one of the most significant changes is the gradual loss of elasticity in the blood vessels. When we are young, our arteries and veins are flexible, allowing them to expand and contract easily as blood pulses through them. But over time, the walls of these vessels stiffen and thicken. This loss of flexibility means that blood has to work harder to move through the body, leading to slower circulation and greater strain on the heart. In addition to natural aging, common health conditions that often arise later in life further complicate the situation. High blood pressure, for example, pushes blood against the artery walls with too much force, gradually damaging them. Diabetes, another widespread condition among seniors, causes the blood vessels to become inflamed and narrows them, reducing blood supply to vital tissues. High cholesterol promotes the buildup of plaque inside arteries, a condition called atherosclerosis, which can severely restrict blood flow and even lead to blockages. Another crucial factor is lifestyle changes that often accompany aging. Many seniors naturally become less physically active due to joint pain, decreased energy, or other health concerns. Sitting for extended periods reduces the natural pumping action that muscles provide to help push blood back to the heart, especially from the legs. Combined with poor circulation, this can create a dangerous cycle where inactivity worsens the very problems it was meant to avoid. Beyond the blood vessels themselves, the body's ability to heal also slows down with age. Our immune response weakens, meaning injuries take longer to heal and infections are harder to fight off. Poor circulation compounds this problem by limiting the delivery of oxygen and nutrients necessary for recovery. A small cut or sore that would have healed quickly in youth can become a persistent wound or even develop into a serious ulcer in later years. Stress also plays an underrated role. Chronic stress, which can accumulate over a lifetime, keeps blood vessels constricted and blood pressure elevated, both of which can worsen circulation over time. Without healthy ways to manage stress, the risks to vascular health grow silently but steadily. The good news is that awareness brings power. By recognizing how aging affects circulation, you can take smart steps to minimize its impact, like staying active, eating heart-healthy foods, managing chronic conditions carefully, and staying hydrated. Most importantly, understanding that poor circulation isn't just an inevitable part of getting older helps you stay engaged in your own health journey. With the right care and attention, it's absolutely possible to maintain vibrant, healthy blood flow well into your golden years. Improving your circulation might sound like a big task, but the truth is, there are so many simple and natural ways you can help your blood flow better every single day. These aren't complicated treatments or expensive therapies, just small, meaningful habits that, when practiced consistently, can transform your overall health and energy. One of the most powerful ways to boost blood flow is through regular movement. Your muscles act like pumps, helping push blood through your veins back to your heart. When you move, you energize this system. You don't need intense exercise, gentle walks, stretching routines, or even dancing to your favorite music in the living room can work wonders. Aim to stand up and move around for at least a few minutes every hour, especially if you spend a lot of time sitting. Think of movement as medicine for your circulation. Staying hydrated is equally essential. Blood is mostly water, and when you're dehydrated, it thickens, making it harder to circulate efficiently. Many seniors don't feel as thirsty as they once did, but that doesn't mean the body doesn't need fluids. Try carrying a water bottle with you throughout the day and sip it regularly. Herbal teas, broths, and even eating fruits high in water content, like watermelon or oranges, can contribute to your hydration. Deep, mindful breathing is another simple yet powerful tool. Most of us breathe shallowly without realizing it, especially when stressed. Taking a few minutes each day to focus on slow, deep breaths can help oxygenate your blood and relax your blood vessels, promoting better flow. You might try a simple practice: breathe in deeply for 4 counts, hold for 4 counts, and breathe out for 6 counts. This small ritual calms the nervous system and supports healthy circulation at the same time. Massage can also play a valuable role in encouraging blood flow. Massaging your feet, calves, hands, or arms gently in circular motions helps stimulate circulation in areas that might otherwise feel stiff or sluggish. You don't need to visit a professional spa. Taking 5 minutes a day to massage your own feet or hands can make a real difference. It's not just about physical benefits. Touch itself has a calming, healing effect on the whole body. Eating wisely is another cornerstone of circulation health. A diet rich in colorful fruits and vegetables, whole grains, lean proteins, and healthy fats like olive oil supports your blood vessels from the inside out. Foods high in antioxidants, like berries, leafy greens, and nuts, help protect the lining of your arteries and keep them flexible. On the other hand, minimizing processed foods, sugary snacks, and excessive salt intake can prevent further damage to your vessels. Every healthy meal you enjoy is another step towards stronger, more vibrant circulation. Keeping stress in check is crucial too. Chronic stress tightens your blood vessels and raises your blood pressure, making circulation harder. Finding activities that relax you, whether it's listening to soft music, spending time in nature, practicing gentle yoga, or simply chatting with a friend, can release that tension and allow blood to move more freely through your body. Even setting aside just 5 minutes a day for something joyful can have profound effects on your circulation and your mood. Another wonderful practice is elevating your legs, especially at the end of the day. Gravity can cause blood to pool in your lower legs when you stand or sit for long periods. By lying down and propping your legs up on pillows, you encourage blood to flow back toward your heart. It's a soothing, easy practice that you can turn into a daily self-care habit while you relax, read, or watch your favorite shows. Finally, wearing loose, comfortable clothing can help circulation too. Tight clothing around your waist, thighs, or calves can restrict blood flow without you even realizing it. Choose garments that allow your body to move and breathe naturally. Comfortable, supportive footwear also matters, especially for maintaining healthy circulation in your feet and legs. Improving circulation doesn't require dramatic changes overnight. It's about weaving small, thoughtful habits into your daily life. Habits that nourish your body and mind, and the beauty is, every single positive choice you make today builds a stronger, more vibrant you for tomorrow. Your body will thank you with renewed energy, warmth, and vitality for years to come. While adopting healthy habits is incredibly important, sometimes professional help is necessary to ensure your circulation stays strong. If you notice persistent symptoms like swelling, numbness, constant coldness in your limbs, slow healing wounds, or sudden changes in skin color, it's time to reach out to a healthcare provider. These signs are your body's way of waving a red flag, telling you that blood isn't moving the way it should. Early intervention can prevent more serious complications like infections, tissue damage, or even strokes. Don't wait for symptoms to worsen or become unbearable. Seeking medical advice early allows for proper diagnosis, personalized treatment, and the best chance to protect your long-term health. Remember, taking action at the first signs of trouble is a powerful act of self-care and one of the best gifts you can give yourself and your loved ones. Your body is always speaking to you. You just have to learn how to listen. By paying close attention to these early signs of poor circulation and making small, meaningful changes, you can protect your health and stay vibrant at every stage of life. Remember, it's never too late to start caring for your circulation. Every step you take today brings you closer to a healthier, stronger tomorrow. We'd love to hear from you. Have you ever experienced any of the symptoms we talked about today? Share your thoughts and experiences in the comments below. And if you found this video helpful, please support us by liking, sharing, and subscribing to our channel. We're here to walk this journey of healthy aging together with you. Take care and stay well.